talk about the history and communication section of the exam. As I mentioned previously, this is very, very important, and you can score a lot of marks here, which can then be used to compensate for a weaker station that you may have had earlier. Now, when you go into the exam, you will see lots of people there. There'll be 2 examiners. There'll be maybe an actor, actress. There'll also be a trainee examiner and someone that is assessing everyone, especially the examiners. You will be given a sheet of paper with pencil and a pen to write on. You don't have to use it, but my advice would be to take the paper and the pencil and write down some headings on it so that you don't forget anything. And I'll show you what I mean in a minute. The important thing to remember in this station is that you have 20 minutes, which is a very long time. Because in clinical practice, we normally see a patient, diagnose and examine and diagnose and provide treatment in about 5 minutes in practice. So you have 20 minutes in this station, and quite often candidates finish and have nothing to do. So I advise you to take your time. Remember, this is it's all about history communication, which means that you have to give some time for listening as well. It must not be a monologue, it must be a dialogue between you and the actor or actress. So there's lots of time, so take your time. Usually the first part section of the exam is 10 minutes where you take a full history. And then the second part will be what will you do next, examine, investigate, and then you may be given some results, and then you have to counsel the actor or actress regarding the results. So it's quite a long station. It carries a lot of marks, equivalent to otology or head and neck, for example. So with regards to the paper, this is what I suggest that how you write on the paper. And I'll tell you why. The age is very important of the patient as well as the occupation. And you need to get that out early. The reason is that there's some diseases in ENT that are occupationally related. For example, a carpenter, they usually have nasopharyngeal carcinoma. So if you see the patient is a carpenter, you know straight away along those lines, there may be an issue of sinonasal disease. Similarly, if the patient is a chef, there may be some issue pertaining to anosmia. So I suggest that you write the heading, age, occupation, then the presenting complaint, the history of presenting complaint, and systems review. If the patient has a problem with the nose, the system review should start with the ears and the throat, and then the rest of the body, which you can go through quickly. I also suggest that you also include the drug history, family history, and social history. And all of this should take 10 minutes approximately. Now, when you finish your history, there is one get out of jail card that you should use, and that is, you should always ask this question: is there anything else you think I should know about? In this way, if you miss anything in the history, the actor and actress must bring it up at this stage, and in this way, you've covered yourself.